We have a goal here in the next few minutes here on San Diego Living, and it's very, very simple. It's to get you back to the lifestyle, the active, fun lifestyle that you maybe used to enjoy and don't any longer because you just don't feel right, okay? We're going to get you back to that right now, so pay attention, get ready to make a phone call, okay? Dr. Jamie Kaiser is here to get you back into balance. Jonathan Pavlik, one of his patients and a big believer in something called NUCA.
We're going big picture here today, Mark, and I really liked how you set that up with if your life's not where you want it to be. What we're talking about today is not neck pain. We're not here to talk about back pain or migraines. We're talking about a body that's not working right, nerves in your body. If you cut them, the organs don't work. If you irritate the nerves, the organs don't work as well. And so what we do with NUCA, make a very specific adjustment when needed up here at the very top, where every nerve has to pass through. When you remove that irritation, life gets better.
Now, again, most folks, when you talk, this is a form of chiropractics that is very, very simple in its
in the premise,
in the practice,
but very scientific, very measured,
yes,
very minimally invasive. But we need to figure out what people are watching here today if they're a good candidate for the kind of work that we do.
Okay, and again, we want to go way beyond just back pain and neck pain and so forth. And that's why you brought Jonathan in today.
We're going to talk about trajectory of someone's life, not just the removal of pain, but where is your life going to grow to if you can get back to doing the things you want.
Okay, so Jonathan, you are a pretty active guy.
Yeah.
But at various stages in your life, that has not been the case. Kind of give us, again, we're doing big picture today.
Yeah, well, a big thing for me is I'd kind of focused on improving nutrition with taking different supplements like Limu and Blue Frog, but I hadn't done anything to get to the core of my posture and things like that. So through my dad, I went to Jamie, and he helped me so much to actually notice looking in the mirror that, you know, I can actually see my pecs now, which I couldn't see before because I was hunched over.
You were hunched over. Yeah.
Right.
So this, we've got like pictures of you zip lining, I think, here, and some various things. You got some other things going on though,
right,
with your body. Tell me a little bit about that.
Well, I have had cerebral palsy, obviously since birth, and I've struggled a lot with that, trying to, you know, do different things and trying to stay active. And my parents both have been very supportive in kind of making me try everything. So I've done snow skiing and water skiing, different things like that with adaptive equipment. But
so, Doctor, I'll talk a little bit about what's going on here with Jonathan, in that other doctors might have ascribed some of the challenges that he was facing to the cerebral palsy when it's not necessarily the case. That's kind of a catch-all.
Of course.
And there's more to it.
There's more to it. So we've had patients we've brought on with cerebral palsy, with MS, with migraines, with sinus issues. We don't treat those things. Okay? As far as I know, there is no treatment for MS. There is no treatment for cerebral palsy. So why treat it? Instead, what we do is correct the imbalance at the top so the body works correctly. And now, are there still challenges with walking, with skiing? Yes. But what if 50% of those challenges were due to something we can change? Instead of sitting at home saying, well, 100% of my problems are due to this label the doctor gave me. Not necessarily true.
Now, folks, what I want you to do right now is I really want you to start thinking about if this is making sense to you. Now, certainly back pain, neck pain, all those things can be easily attributed to some kind of misalignment, which is what you deal with. But think about the bigger picture here and some of the other things that you're dealing with, and then pick up the phone and make a call. We're going to ask you to make an appointment and come in and see Dr. Kaiser absolutely for free with no obligation whatsoever. And then if you decide to pursue it, got a special offer for you as well. So go ahead and get ready to make that phone call.
I just want to go back to the skiing. Okay, so your dad, who we actually have had on the show as well, Floyd, was on here probably about 3 months ago talking about how his blood pressure had dramatically lowered after getting care at our office. So you used to ski, but what do they do with the tips of your skis to kind of help you?
I have it's called a ski bra, and it's a metal device that holds the tips together so that you know, I can be going down the hill straight for
right.
And recently I went on a ski trip since doing the NUCA, and I didn't need to use that tip anymore. I was able to ski without that piece of the adaptive equipment.
It's got to be liberating.
Yes, definitely.
Yeah, I see the smile on your face, and this is the thing here. When you see somebody with that big grin,
Yeah.
you know something's happened in their life. You know that's really genuine. When you see the twinkle in their eye, there's been a transformation. There's been a change. Tell me about the NUCA treatment itself, because this is what is so fascinating to me. And I want to see if your response is kind of generally the same as we usually hear. You go in, you see Dr. Kazer, what happens?
Well, it's very easy. You just lay on the table, you know, on your side, and it's almost like getting a very gentle neck massage. And you do that, and you get up and look in the mirror, and you can see your posture changing right away, which is amazing to me.
So for you, you were laying on the table. When you sat up, what did you notice? Because you said something like, as soon as you came up.
Yeah, I just noticed tension and a lot of pain just go away instantly. And that was on the first visit. And by the third visit, I was taking the stairs to his office simply because I could. So,
Wow.
I mean, we're talking about, you know, how old are you? 20? 30?
31.
31, right?
Yeah.
So, you know, 30 years, and there's a change within a week, 2
Sure.
weeks, 3 weeks, 2 seconds. That's not because we're so great, okay? That's the power within your body being released, able to work like it's intended to.
So again, the idea is that there's something wrong up here in the neck that's pinching that nerve.
Structural misalignment.
Right.
If we can see that, if we can verify it on x-ray, which is what we do when you come in for the first visit, so we can determine, are you in the right place? If we can see it, if we can change it, you're going to notice results.
You do a lot of measurements, a lot
It's
of
very, very
pre-planning,
scientific.
so that this is very targeted. But again, I want to emphasize very gentle. I mean, you say it felt like a gentle neck massage.
yeah, I mean, it feels, you're not feeling much of anything, but you notice the differences right away, which I thought was incredible.
And
So-
I know we got 3 seconds here. Pretty
Well,
much,
no, we
but
got about a minute, but
left,
I
okay.
want to just
'Cause
tune people in here to grab the pencil, because we're going to explain how you get the free appointment and a great deal if you decide to go forward on the treatment.
So we talked a bit, and Jonathan's obviously a very positive guy, right? And I don't know if he's always been that way, but the biggest thing that we got to talk about is the bigger picture, how it affects someone's life, their self-esteem. I remember on like the second or third visit, he comes into the office, and we do a lot of our work in front of the mirror so people can actually see the changes. He comes in, and he stands in front of me, he sticks it out, he goes, I got pecs now. And he's got like this major grin across his face. And it's not that the pecs weren't there before, but posturally, he was so rolled in because of the compression up top, his body thought this was okay. We change it, it comes back. Again, he's always going to be positive throughout his whole life, but what if you've got a child at home who self-esteem issues, who's just not feeling comfortable in their own body? What does their life look like? We're here today to let people know, look, we can make a change. This is what we do, and let's change the trajectory for the next 70 years of someone's life.
Well, there's the number on the screen, folks. And here's the deal. You come in and you see the doctor. It's free for an exam, free to meet the doctor. Once you discuss this with the doctor, then if you decide to go forward, the x-rays are just $49, and normally that would be about a $200 value. So for the first 12 viewers, that's your deal right there. Come in, the exam is free, but if you decide to go forward, the x-rays are $49. The one thing I will tell you, do not be surprised or shocked when they ask you for a credit card when you call to make the appointment. That's just to reserve your place. You're not going to be charged, but that's just to reserve your place. And then if you go forward, you can put it on that credit card, you can pay cash, you can make arrangements
We got
in the office.
lots of arrangements in the office,
Right.
and again, you are going to be getting our call center. So if you got a billion questions for them, I'm sorry, they're not going to be able to answer them, but they will take a message. Our staff will call you back later. But make that change. You know, just do something today, and this, just imagine where your life could be, you know, tomorrow or 5 years from now. That's what this is about.
Jonathan, thank you so much. Dr. Kazer,
you.
thank you. And again, I told you we had a goal this segment to get you feeling better. We've laid it out for you. Now it's up to you. Make the call and come in and see Dr. Kazer. All right, for more information, you go to san diego6.com and you click on San Diego Living.